Good day everybody. Today in this video we'll have a look at the Sirago Ultimate Gap Cover for 2024 with specific reference to the benefits that's available for all the Sapro employees. I'd like to start this video by pointing out that Sapro has a reduced rate of 290 Rand for an individual or 366 Rand for a family. That is a major discount and much cheaper than what it's available in the free market. So first of all, let's just quickly have a discussion regarding what gap cover really is. Gap cover started as a benefit where gap covers pays the difference between what the doctors charge and what the medical schemes pay. This means if you go in for a procedure, say you have a knee operation and the orthopedic surgeon charges 10,000 Rand for the procedure, but the medical aid only paid 5,000 Rand for that specific procedure, there's a gap of 5,000 Rand, which you would have normally had to settle out of your own pocket. The difference of 5,000 Rand can now be submitted to a gap cover, and the gap cover will settle that bill into your account, and you can then pay the surgeon with that. All medical schemes negotiate with specialists or in-hospital doctors to pay a certain rate for any specific procedures. And the gap cover that you guys have with Sirago pays 5 times the agreed rate. So in other words, if the agreed rate for a procedure, any specific procedure, this would be for the doctor's specific services and not for the hospital accounts and those kind of things. But if the agreed rate is 5,000 Rand, you can claim 5 times more than that from your gap cover benefit. So that's a really nice benefit that you've got going there, and the original benefit that gap cover was created for. One of the other things that we claim for the most is co-payments. So those that are on BestMed, there aren't really many co-payments with BestMed, but Discovery does have some co-payments. These can be for anything like MRIs, endoscopic procedures, or in-hospital dentistry. Those co-payments range and can usually run up to a couple of thousand. And this is something that you can claim back from your gap cover. The next thing that's very important is the penalty fee co-payment. So the penalty fee co-payment comes into play if you are making use of a network hospital on your plan. So if you can only go to a specific hospital in your area, then there might be a co-payment that you have to pay if you go to the wrong hospital. On the Sirago option, you can claim twice per year for up to 16,000 Rand per claim, which is sufficient for the co-payments on BestMed and Discovery that you effectively have access to any hospital of your choice. Now, the rule on this is not that you always have to pay this at the hospitals, although the hospitals do sometimes require you to pay it upfront, and then you send your proof of payment with a gap cover claim form through to the Key Wealth office, and we assist you to process that claim and get you reimbursed as soon as possible. It is always our recommendation that if you do have a network hospital, that you spend a little bit of extra money on the gap cover, because that just opens you up. If you don't have it, it just opens you up for unnecessary costs out of hospital. What's important with this specific benefit is that it's very easy to do a planned procedure at a planned hospital. But if you are in an accident and the ambulance takes you to the closest hospital, and that hospital is not on the Discovery or on the BestMed network, you might be liable for those co-payments. So a very important one to look out for. The Sirago Ultimate Gap Cover also provides cover if you are in a day hospital, a clinic, or in-hospital surgical procedures. This just basically means that it doesn't have to be in a general hospital like we are used to. One of the other very important benefits to keep an eye out for is that the Sirago option does pay for prescribed minimum benefits. Now, very important, prescribed minimum benefits is the legal limitation that has been placed on medical aids, that all medical aids have to pay for prescribed minimum benefits. That means that if your life is in danger, or the use of one of your limbs are in danger, or the loss of a limb is possible, then medical schemes have to settle the bill at cost. This means, if you look at the example that we had above, if there was a 10,000 Rand procedure that was done and it's a PMB, technically speaking, the medical aids will have to pay the full 10,000 Rand, and it would not be a gap cover claim. But what medical schemes did, all of them, including BestMed and Discovery, is they included designated service providers, or DSP in short. If it's a PMB benefit and you did not use the designated service provider, then the medical scheme only has to pay the agreed rate. Now, depending on your option, that can be 100%, it can be 200%. There are even options that pay 300% with Discovery, and they will only pay up to those rates. So if they charge more than 1, 2, or 300%, you will be liable for it because you did not use the correct designated service provider. What this benefit does is it gives you peace of mind so that you know whether you go to a designated service provider or any available doctor, you will have the benefit of claiming whatever the medical scheme does not pay for their services, you will be able to claim on the gap cover. So this is a great benefit and a very important thing to keep in mind. Sirago also covers hospital account shortfalls. In short, this is almost like a catch-all benefit. So there's 7,000 Rand per policy, 1,500 Rand per claim, and anything that's not settled with your medical aid while you're in hospital is a valid claim on this. There's 2,000 Rand that's available for private wards. This is a very popular benefit for people that go into hospital for a short time, in other words, for like a day or two. Then what they've got is they can upgrade to a private ward. The medical schemes pay out the same price that they would for a general ward. There's a shortfall on the hospital bill, and Sirago will settle that bill up to 2,000 Rand. Very popular for ladies that are giving birth. You can have access to a private ward with your newborn, and it doesn't cost you anything out of your pocket as long as the claim difference stays under 2,000 Rand. Next up, we've got the sub-limit enhancer benefit. So this is very important for anybody that has any internal prosthesis. So whether it's a mesh, a stent, a hip replacement, a joint, anything like that, if there's a shortfall on the sub-limit on your medical aid, Sirago covers that up to 35,000 Rand on prosthesis. For those on BestMed, BestMed only pays up to a certain amount out of hospital for MRI and CT scans on most of their options, and this is a nice benefit to fill that up. So as an example, just to keep the math simple, if you need to go for an MRI scan when you're as an out of hospital patient, and BestMed pays 5,000 Rand for it, it is a little bit more, this is just for the math, and the scan is 15,000 Rand, you would have been liable to pay the difference, which is 10, but with this option on the Sirago Ultimate with Sapro, you can effectively claim that back from Sirago, and you won't be out of pocket. Important to know, if you go for a new procedure, or it's a CT scan or another MRI scan, it's 5,000 Rand again, and BestMed will not pay anything, and that means that if they charge 15,000 Rand for the scan, you will essentially have to pay the full 15,000 Rand, and we won't be able to cover that back, claim that back from the gap cover. Next up is a step-down facility. It works very similar to the day hospitals. This is usually in subacute facilities or somewhere where you go for rehab after an operation and they don't have any theatres or things like that. BestMed does cover that if there are any short payments on that. I said BestMed Sirago, up to 11,000 Rand. Right, let's discuss the out-of-hospital benefits. On this option, Sirago Ultimate, there is primary care available for GP consultations, dental consultations. Important to note, it's consultations, not any treatment. Alternative therapists like chiropractors, physiotherapists, biokineticists, occupational therapists, homeopaths, and audiologists. And what would happen here is what we've seen is very popular is if you see a GP after hours, or they might be open on a Saturday, and they charge 800 Rand for their consultation, and the medical scheme only pays 450. The difference of 350 you can claim back from Sirago Ultimate. This would be true for the dental consultations and all of that. Just remember, especially with the dentist consultations, that this is for the consultation only, not the x-rays or the fillings or any work that's done. Same with the GPs, it's not if they give any medicine or any treatments, it's just for the consultation. Keep in mind, please, that there is a minimum claim amount of 100 Rand, so if the shortfall is only 50 bucks, you would not have a valid claim on this. Okay, next up we've got specialist fees. So this is also very nice. If you see a specialist, as long as your medical aid pays with the above primary care benefit as well, these won't be applicable to someone who's on a hospital plan or if their savings has run out, because there's no payment made from the medical scheme. If there's a payment from the medical scheme and it's not a short payment because you don't have enough benefits, it's a short payment because the doctor charged more than the medical scheme rate, you have 1,500 Rand for specialist consultations up to 6,500 Rand per policy. This is a very nice benefit for people who have started with family planning, and the ladies can go to the gynecologist, and those shortfalls on payments for them will be covered from this benefit. So a great thing to keep in mind. Another great benefit with Sirago is that they've got emergency room cover. This is very valuable for everybody, but especially for those with children that are 8 years and younger. I'll discuss in a little bit detail here. So first of all, there's an illness benefit. The overall benefit of this whole emergency room benefit is 15,000 Rand for the year. But you've got an illness benefit for all the adults or the children that's 9 years or older for 2,500 Rand. So that's for those late night illnesses that you get, so high fevers or massive infections or fevers that don't go down, anything that's worrying. It can be anything really. They will cover up to 2,500 Rand if you put in a claim through Sirago. And if it is for a child that's 8 years or younger, they can utilize the full 15,000 Rand. So for anybody specifically, that's got young kids, this is a great benefit because you've got 15,000 Rand of ER facilities for your kids. The accident and trauma benefit, lastly, this is available for everybody that's covered on this option, and the full benefit of 15,000 Rand is available for everybody. We see a lot of claims with this where it's small injuries, you cut yourself with a knife in the kitchen and need some stitches, minor vehicle accidents where nobody seriously gets hurt but they do some x-rays to check that everything is okay, and things like that. You had a fall and sprained an ankle and so forth. There's a primary care benefit. Very few schemes do short payments on this, so we rarely find value in this on the best met and discovery options because they pay it quite well. But what's very nice is for certain benefits like pap smear, child immunizations, mammograms and bone density scans, if your medical scheme pays for this and you've got, as a pap smear as an example, it's an alternating benefit, you can get it this year or once every 3 years, then you claim for it 1 year on your medical aid, and the next year if it doesn't go through, then Sirago will pay 500 Rand towards that specific benefit. So that's also very nice. There's an appliance benefit. Again, this is only for the shortfall. In other words, your medical aid has to pay it out of risk or day-to-day benefits, and then if the supplier charges more than what your medical scheme pays for wheelchairs, CPAP machines or anything like that, then there's a 7,500 Rand claim that you can potentially have. Trauma counseling is very nice. It's for anything that's rather serious. So within the first 6 months, if there's a traumatic event, it can be a dread disease like cancer, hijacking or part of a violent crime, then you've got 10,000 Rand to claim to see a registered psychologist. There's an accidental dental benefit. So if you are in a vehicle accident or a cycling accident or something like that and you lose 1 or 2 of your teeth, you can claim up to 2,500 Rand per tooth and 10,000 Rand per policy to get some work done on your teeth. With regards to cancer is the co-payments. So the co-payment portion is applicable to discovery, where once you have exceeded the 250,000 Rand limit on discovery, there's a 20% co-payment, and then that is covered until you reach your overall annual limit of just above 200,000 Rand. So that gives you very, very decent cancer cover. With BestMed, there's a cancer booster. So with the BestMed members, what happens is that if you get diagnosed with cancer, you get a treatment plan. The treatment plan is then submitted to BestMed. BestMed would recommend which option is best for you. You can do an upgrade if it's necessary, and then should there be a shortfall, usually it's with biological drugs like Herceptin for breast cancer, and there's a limit to what they would pay out for that, then you can claim that on the cancer booster benefit. So that's a great benefit as well. And then a stunning benefit for the ladies. For those that are affected with breast cancer, normally the medical aids only pay for, they do a double mastectomy, and then they normally only pay for the reconstruction of the cancerous breast. What Sirago has gone and done is they would pay out 40,000 Rand for the healthy breast or the unaffected breast as well, so that you can get breast reconstruction on both breasts and do not sit with a prosthetic bra or something like that. They would also pay 4,000 Rand for any artificial prosthetics, and this is something like wigs or breast implants or post-mastectomy bra prosthetics. So that's also a very nice benefit. And last but not least, we've got some value-added benefits. This is something like if there's a death or permanent disability, it must be accidental of the policyholder, then Sirago would cover the premiums of the gap cover for 6 months, and the same as with the medical aid for 6 months up to 5,500 Rand per month. So that means that your loved ones can continue having cover. There's also an accidental death benefit, 16,000 Rand for the policyholder, 11 for adult dependents, and 6,000 Rand for a child. Important, it must be accidental. There's also initial cancer diagnosis. So if you get diagnosed with cancer for the first time, you have 30,000 Rand that will pay out from Sirago. What makes this very nice is that getting diagnosed is expensive with cancer, because all of the tests and histology reports and oncologists that you see and all of that comes out of your day-to-day. So many people are left out of pocket here, and then should you receive the unfortunate news that you do have cancer, Sirago comes in and they help you a little bit with that. It's also a beautiful benefit with Sirago Baby, where they pay out 2,500 Rand as a lump sum to you if you register your baby on Sirago within 90 days. So that's to use for whatever you want to, and it's a great benefit. You can also use Sirago Medcare, and that is some assistance that you can receive if there are claims that are being disputed with PMBs. So great benefit. If you need that, you can reach out to us. And that is, in short, the Sirago gap cover benefit on the ultimate option for the Sapro employees. If there's anything, please reach out to Key Wealth. Our office number 051 88 00 111. We look forward to talking to you and assisting you in any way possible. Goodbye.